One of the exercises that we really like to start folks with when they have shoulder pain, or that you could do at home, is an exercise that basically strengthens the rotator cuff muscles in the direction of outward rotation. So this is good for somebody who has a sore, achy shoulder but still has full range of motion. So if you're able to rotate your arms outward, okay, with no gravity, or if you're able to lie on your side like Riley and rotate your arm outward and it's not painful, then this is probably a good exercise for you to start. So we're going to walk through how to do the exercise correctly. One of the things I like to do is have folks put a little towel roll underneath their elbow. Go ahead and relax there, because that towel roll just helps to kind of level out your arm and make sure the blood flows good here when you do the exercise. Now, what I want you to do, Riley, is just roll your arm out, no pain, and just nice, easy tempo, like it's a metronome, right? So just up and down, nice and smooth. You don't have to hold it at the end. And so I would recommend that we start with maybe 15 at a time and do 3 sets. And Riley, where I want you to feel it is kind of on the back side of your shoulder, not in terms of pain, but I want you to feel just a little bit of fatigue in those muscles back there. Perfect. You feel like you want to try a little bit of weight?
I think so.
Okay, so the weight that you're going to use is real small, so we're going to try 1 pound. The rotator cuff muscles are very small, so we're going to have a very small load, but we're going to do a high number of repetitions. Okay, go ahead and try that and see how that feels. So again, just nice and steady. One of the things you'll notice is when you do these things and you start to get tired, it really becomes difficult to make the exercise smooth. Your arm might shake just a little bit, which is fine. But again, what I want the prevailing feeling to be is sort of fatigue on the back side of the shoulder, but not pain. So go ahead and slow it down just a little bit. Feel comfortable?
Yeah.
Feel the difference between no weight and 1 pound? Yeah, it's surprising. So it's always nice to try this out, very carefully kind of work your way up. My recommendation at home is you start with 0 and maybe you work up to 2 or 3 pounds. One of the other exercises that we like to do for folks with rotator cuff weakness or shoulder pain, assuming they have enough range of motion, is this particular exercise where we have an individual lie on their stomach and extend their arm straight out from their shoulder and slightly above their shoulder, so that when Riley looks out at his thumb, it's straight out from his eyes. And this arc of motion helps to strengthen the back side and the top side of the rotator cuff. So I want you to do that smoothly about 5 times, just all the way up and all the way down. Maintaining the thumb pointed toward the ceiling really helps ensure that the rotator cuff is working maximally. It's a difficult exercise because of the length of the arm is at its maximum, so not much weight is needed. Does that feel like you might want to try a little bit more weight?
Yeah.
Okay, so let's try 1 pound. Okay, so when you do this at home, you might start out with no weight and do 15 repetitions at a time. If it feels easy, add a ½ pound or 1 pound up to doing maybe 3 sets of 15 with 1 to 2 pounds at the most generally. Should be pain-free and just a sense of fatigue on the back side of the shoulder. Shoulder pain is a common occurrence in people who are active, people like Riley who are involved in sports, people who work with overhead activities. It's fairly common, and to some extent it can be controlled with gentle exercise, as we've shown here, to strengthen the rotator cuff, as well as occasionally with taping, which you might need to see a physical therapist to perform. In addition to that, using ice, resting the shoulder from the things that you know are going to bother you. If the pain persists for more than a couple weeks and you've done gentle exercise, icing, maybe some taping and resting, and it still persists, or if you have pain at night or pain at rest, that might mean that you need to contact your physical therapist.